Assalamualaikum. My name is HASIF and our group will be presenting about mandatory public health insurance. But first, we need to understand universal healthcare coverage. Universal healthcare coverage is a system in which communities can access the necessary health treatments while simultaneously ensuring that the use of these services does not place users in financial hardship. Mandatory public health insurance is a policy that falls under this system. So, what is mandatory public health insurance? It is a policy where all citizens are mandated to acquire health insurance from private or public health insurers. These insurers are often required to provide a specified minimum level of coverage subsidized for low-income individuals and a provision on underwriting and for-profit insurance. Payment for such insurance amount to a tax where employee may be required to pay contribution on behalf of their employees.
Hi, Assalamualaikum. My name is ABDUL bin MOHAMED. What is the benefit of mandatory public health insurance? Let me tell you. Among the countries that adopt the policy of mandatory public health insurance is Albania, where the policy includes free medical visit in public health institutions paid by health insurance and based on referral system. Secondly, free domicile visits when the patient's health condition prevent him or her to be present at the health institution. Thirdly, medical examinations at the public health institution are free or with co-payment, where examinations are reimbursed at 90%. Medical care at contractual public or private institutions, and depending on the category, full or partial drug reimbursements where partial payment may amount up to 50% of the drug's price.
Germany also implement the policy of public health insurance. About 88% of the population receive primary coverage through sickness fund and 11% through private insurance, where voluntary coverage of benefits are not included in statutory insurance. The policies that is included in Germany's mandatory public health insurance included the following: free primary care visit and specialist consultation, co-payment of €10 per day including pharmaceuticals, for covered prescription drugs, co-payment of minimum of €5 and maximum of €10, or the price of drug plus the difference between the price and the reference price. No co-payment if the price is 30% lower than the reference price. And finally, the co-payment for prescribed medical device is between €5 to €10.
So, seeing that we are clear about the concept of mandatory public health insurance and how some countries adopted this policy, could it improve the healthcare quality in Malaysia? The answer is yes. Let me explain. The current Malaysian public healthcare system is tax-funded, where healthcare costs are highly subsidized. The government covers around 99% of overall public sector healthcare expenditure, which results in a relatively low public healthcare funding. This situation is even pre-pandemic, as seen by this tweet by the Director General of Health Malaysia commenting on this issue in July 2019. So, how could mandatory public health insurance resolve this issue? By adopting this policy, it should be noted that this policy is not intended to replace the current tax revenue system, but rather to support it. This is because funding sources have the potential to produce a resilient, predictable, and sustainable healthcare finance system. Furthermore, the establishment of government-backed insurers might shift the finance away from the existing high post-paid out-of-pocket percentage and towards a lower prepaid insurance percentage, thereby enhancing purchasing power and creating economies of scale. Hence, that is how mandatory public health insurance can improve the healthcare quality in Malaysia.